I'm Mandara Singh. I am the head of product and partnerships at Collective Medical. I think it's really important as we think about a value-based care to remember that now all of a sudden providers have to care about what's happening with a patient once they leave the four walls of their practice, right? Not only do they have to care because that's part of their Hippocratic oath, they have to care because they're financially on the hook for it. And so what we're seeing is that whereas before there were those progressive, motivated providers that were involved in the continuous care of their patients, now you see institutions investing in solutions to help them understand what's going on. Because the reality is there isn't a lot of visibility, right? What in terms of a skilled nursing facility, understanding what happens when a patient leaves, or a behavioral health clinic who by definition deal with some of the most vulnerable patients in our continuum. To them, understanding those underlying risk factors that they might not have encountered, but others across the continuum have, could be that difference between them discharging a patient who isn't ready yet and having that readmission occur, or understanding the risk associated and keeping them in care for that extra day because ultimately it's a better outcome for the patient. What we see often is the hard, fast rules that don't work, right? This is not, a patient is not always adherent to an algorithm. They're individualized and it's their specific history that should be taken into account when we're making decisions about their health across the whole continuum.